laxatives, a bulk stimulant, and I'm going to talk about my two drugs, which are the Lactulose and Magnesium Citrate. So first, I'm gonna share to you my first drug. So, I am Lactulose and that's my generic name. My brand names are Cifolac, Eniluse, Crystallose, Centiluse, Generilac, Colac, Chronolac, Constilac, Dufalac, and Heptalac. And my chemical name is this. I am classified in the therapeutic classification as osmotically acting laxatives. And in pharmacology classification, I am classified as a disaccharide. So, in pregnancy category, I belong in category B. So, in mechanism of action, I am a synthetic product that cannot be hydrolyzed by any gastrointestinal enzyme. Therefore, oral doses of my drug reach the colon virtually unchanged. In the colon, normal bacterial flora degrade my drug into lactic acid and small amounts of formic and acetic acid. This acidic environment ionizes ammonia in the colon to the ammonium ion. Once ionized, ammonia, now in the form of the ammonium ion, cannot diffuse across the colon membrane and is ultimately excreted in the stool. So this process reduces blood ammonia levels by 25% to 50%, which usually has a beneficial effect on the patient's mental status. Also, I can inhibit non-bacterial, glutamine-dependent ammonia production in the intestinal wall. The intracolonic breakdown of my drug also increases osmotic pressure, causing fluid accumulation that softens the stool and the stents of colon, enhancing peristalsis. The effects of my drug occur only in the colon and are therefore motility dependent. A normal bowel movement may not occur for 1 to 2 days. Now, let's talk about my pharmacokinetics. In absorption, after administering me by the oral route, less than 3% of my given dose of my drug solution is absorbed by the small intestine. The remaining unabsorbed of my drug reaches the large intestine where it is metabolized, but even then, negligible quantities of unchanged or its metabolites are absorbed across the colon. In distribution, negligible amounts of my drug, metabolized or non-metabolized, are absorbed into the body. Mostly, my drug is administered subsequently remains predominantly around the gastrointestinal tract area. Metabolism. My drug is essentially only metabolized in the colon by saccharolytic bacteria that are present there. In particular, the substance is broken down into lactic acid and small amounts of acetic and formic acid. So in elimination, my renal excretion manages to be absorbed into the circulation and has been determined to be 3% or less and is generally complete within 24 hours. Label any unabsorbed my drug is largely excreted with stool. So, I am indicated for use as a laxative in the treatment of chronic constipation in adults and geriatric patients. I am contraindicated in patients having gastrointestinal obstruction, acute inflammatory bowel disease, patients with galactosemia, diabetics, elderly people, and pregnant women. important to know the side and adverse effects of my drug to your body. In gastrointestinal, I may cause nausea, vomiting, diarrhea in high doses, flatulence, abdominal cramps, belching, gaseous distension. So also in endocrine and metabolic, dehydration, hypernatremia, hypokalemia may experience, and other significant are electrolyte imbalance or the long-term treatment or excessive doses. In order to prevent any complications and errors, here are things that you should do before administering me to the patient. So, before, assess patients for abdominal distension, presence of bowel sounds, and normal pattern of bowel function. Also, assess mental status before, periodically throughout course of therapy, and encourage patients to use other forms of bowel regulation such as increasing bulk in the diet, increasing fluid intake, and increasing mobility. Administer me with a glass with 240 ml, mixed with fruit juice, water, milk, or carbonated beverage to improve flavor, and may be administered on an empty stomach for more rapid. So, after giving my drug through nasogastric tube, flash tube with water to clear it with ensure passage of drug to stomach. Monitor serum electrolytes periodically when used chronically. And tell patients to report unusual diarrhea and monitor chloride and carbon dioxide levels in long-term treatment. So, for the next drug, I'm going to talk about magnesium citrate. So, I am also magnesium citrate, and that's my generic name. My brand names are Citroma, Citramag, and Citromag. And my chemical name is this. So, I am classified in the therapeutic classification as laxatives, and in pharmacology classification as a mineral. Pregnancy category, I belong in category C. So in mechanism of action, I am supplied as an oral tablet or as a liquid saline laxative. I retain water through osmosis in the intestine. Increased intestinal water encourages motility, typically inducing intestinal movements within 1/2 to 6 hours. Also, it functions largely by its high osmolality property, which can attract vast volumes of fluid into the colonic lumen. So, let's talk about my pharmacokinetics. In absorption, the mean plasma concentration of me after administering is stated to be approximately 0.7 millimoles per liter, and the saliva concentration remain at 0.28 millimoles per liter. So, my distribution and metabolism were not known, so let's proceed to elimination. After administering me through oral route, the urinary excretion of my drug has improved by 40%. I am therefore commonly excreted in the urine and when found in the intestine. It relaxes the intestine and attracts water into the intestine, which enhances the flow of the intestine and excretes a large portion of the intestine. I am used as treatment for acid indigestion, constipation, bowel evacuation or cleansing, bowel irregularity, and a nutritional supplement. So, I am contraindicated in patients on a low sodium diet. I should not be given to a patient who has decreased kidney function, diarrhea, high amount of magnesium in the blood, low amount of sodium in the blood, dehydration, appendicitis, blockage of the stomach, and seizures. So, in side and adverse effects, it is important to know the side and adverse effects of my drug to your body. So, in central nervous system, confusion, decreased reflexes, dizziness, syncope, sedation, hyperthermia may experience. Also in cardiovascular, hypotension, arrhythmias, and circulatory collapse. So in GI, I may cause nausea, vomiting, cramps, flatulence, anorexia, and in metabolic, hypermagnesemia and hypocalcemia. In musculoskeletal, muscle weakness, and flacidity. In respiratory paralysis. In skin, diaphoresis, and other adverse effects are allergic reaction, injection site reaction, and laxative dependence. So in order to prevent any complications and errors, here are things that you should do before administering me to the patient. So in before, ask the patient if he is allergic to it or any other allergies. Assess patient's medical history, especially bowel problems, heart disease, kidney disease, current abdominal symptoms such as pain, cramping, persistent nausea, or vomiting. And assess the patient if he had a sudden change in bowel habits lasting more than 2 weeks. To increase palatability, chill the solution prior to administration. So during, administer me in each dose with 8 ounce or 240 ml of water. So after, assess for patellar reflex and monitor for respiratory rate of 16 breaths per minute or more. Monitor blood magnesium level, check for signs and symptoms of magnesium toxicity, and keep injectable calcium on hand to counteract magnesium toxicity. Monitor urine output, which should measure 100 ml or more every 4 hours. So that's for today, and see you next time.